Do you think the shift in emphasis that we're hearing about is justified?
From stay at home, well, I think the messaging needs to be very closely tied to what we really know about the epidemiology of the virus. And as that epidemiology changes, as different measures are put in place to try and control it, the messaging is going to have to change. We can't stay at home forever. With the current R number as it is, the rate of decline of the virus, if we're trying to get down to a position where there are literally only hundreds of new cases a day in the UK, we're going to be in lockdown for months. So something has got to change, both in our approach to controlling the virus, but also in the messaging that goes with that.
And will any easing of the lockdown mean inevitably some increase in the disease?
Well, it depends how you do it. There are various measures you can do that will have very little impact on the R number. One of the unfortunate misconceptions about this virus, I don't think it's unique to the UK, it doesn't transmit at all well out of doors. So outdoor activities, as long as people are maintaining social distancing, and in particular that people with symptoms are not going out and that people who need to quarantine are quarantining, as long as those are held, outdoor activities pose relatively low risk. And we need to understand that not all the measures that contribute to the lockdown are actually contributing equally to controlling R. They're not.
So actually you might quite welcome what they're doing today.
Certain elements of it I would, I think. We do need to get out of this lockdown. It's extremely harmful. You've already talked about the damage to the economy and people's views on that, but it's not just that. There's psychological damage, there's social damage, and there's tremendous knock-on damage to other health issues. There was a paper published last week estimating that because cancer testing has basically fallen over a cliff since this virus, since the lockdown started, 20,000 extra people are going to die of cancer. Now, we've got to start having a grown-up discussion about balancing the harms. And your program today has all been about the public health measures to try and control deaths from COVID-19. But what about these other deaths that we're storing up, the trouble we're storing up by the lockdown? I haven't seen the evidence from the government or anyone else of exactly how we're quantifying this other side of the equation, but that is critical.
So it's important to have a public discussion about that, but it goes without saying any death is one too many. But in terms of public policy and the virus, at what point would you get worried about an increase?
Well, as I said, the release of the lockdown doesn't have to happen across the board equally. There are other things we can do. So, for example, if we're going to increase the lockdown, we are to some degree going to increase transmission of the virus. And that means, among other things, we have to pay extra attention to protecting the people who are particularly vulnerable to the virus. We know who those are, the people who are being shielded and those in the over 70s category who are, and we need to be aware of this, over 20 times more likely than the rest of us to die of COVID-19 infection. So we know that if we want to bring the death rate down, then the obvious thing to do is to shelter, to protect and shield those people from infection. In the rest of the population, the risk of death and the risk of severe disease is very, very much lower.
Professor Mark Woolhouse, thank you very much indeed.